Hi, my name is Onomi Atiyota. I'm a registered nurse. Have been a registered nurse for about 30 years. I live in Blythe, California, and I work for the Blythe prison system, which is one of the prisons in the state of California. Today, we're going to be talking about diabetic management initiative. And you will be wondering, why did I pick a diabetic management initiative? Before we continue the class, I would like to welcome every one of you to this presentation, and I hope you enjoy it and you learn something from this presentation. The reason I picked diabetes is because it's a debilitating illness, and we have to come up with initiative to combat diabetes and tell people about the importance of diabetes, how they can manage their health, and how they can prevent complication or at least reduce the complications of diabetes. The National Diabetes Statistic Report from 2014 states that 29.1 million people, or 9.3% of US population have diabetes. 21 million of these people are diagnosed, while 8.1 million people are undiagnosed. This report was funded by various data systems that was collected from Center for Disease Control and Prevention, the Indian Health Services, National Patient Information Reporting System, the U.S. Renal Data System of the National Institute of Health, the U.S. Census Bureau, and published studies. The estimated percent talks about the diagnosed patient and the undiagnosed patient. The diagnosed diabetes was determined by self-report among survey respondents and by diagnostic code for American Indian Alaska Natives. Both fasting glucose and hemoglobin A1C level were used to derive estimates for diagnosed diabetes and pre-diabetes. The test used to diagnose diabetes vary in who is identified as diabetes or pre-diabetes. So you can see diabetes is not something that we have to joke with because it affects a lot of people. Diabetes can be treated and managed by healthful eating, regular exercise, medications to lower blood sugar. Another critical part of managing diabetes is that if you are able to manage diabetes, you are able to manage some of the complications, such as cardiovascular diseases and high lipid levels. But if somebody continues to smoke, they increase their risk factor because it slows down their healing process and it just makes the diabetes worse. Diabetes can affect many parts of the body. It has a lot of complications. It could lead to heart disease and stroke, blindness, kidney failure, lower limb amputation. Those are some of the complications. Sometimes it damages the microvascular component, and people like this end up being blind sometimes. And the risk is so huge that we really don't want to mess with diabetes. Because of risk of cardiovascular diseases increase in diabetes and pre-diabetes, blood pressure and lipid management along with smoking cessation are very important. Very important. We do have a lot of prisoners that have diabetes also, and if we are able to manage this population, we'll be able to kind of contribute to the health of the community. So in this class, the objective of this class is actually to define the care coordinators that are going to be taking care of this diabetes and define who the care coordinators are, what their roles are. Another objective is for the care coordinators to know, understand, and implement all components outlined in diabetic care management. And also for the care coordinators to identify and review resources that are available to them, and for them to make sure they know what these resources are so they can utilize it in their day-to-day care of their diabetic patients. The mission of the blight prison system is actually to reduce avoidable deaths and illnesses by giving the patients timely access to competent medical and clinical personnel who provide effective care informed by accurate patient record and supported by appropriate housing, medical facility, equipment, and processes. For you to have a prison system, you must have these things in place: equipment, processes, appropriate facilities to house these inmates. Sometimes you might house them in a housing unit and it might not be appropriate. They might need to go to a correctional treatment center or be housed in an actual acute care hospital for proper care. The goal, because of the mission of the prison system, the complete care model has been adopted to take care of this patient. The complete care model is the foundation for healthcare service delivery to achieve continuous, integrated, and coordinated care, especially for patients with chronic and complex physical and behavioral health conditions who disproportionately drive risk and resources. And this complete care model has been endorsed by the National Committee for Quality Assurance, the government-based Agency for Healthcare Research and Quality, and the Joint Commission. This model emphasizes continuous care. And there should be no lapse in care. Continuous care where the patient has a relationship with a multidisciplinary staff, and the staff have the knowledge to integrate what it is that the patient wants so we can provide appropriate care. Comprehensive care. We have a primary care team based on nurses, doctors, the old office technician. They all come together and assess and reassess the patient's health needs, and they collaborate with other health disciplines to provide this patient with appropriate care and services. The care management and subpopulation registries that have been adopted to help with this management of chronic care patients, diabetic patients being one of these chronic care patients. The care given to these patients are coordinated and it's patient-centered. That means the patient is actually involved in the care. And during the process of taking care of this patient, they are provided preventive care to prevent complications of their illness and manage their illness properly. The importance of having access to care cannot be overemphasized. In the past, the inmates didn't used to attend when they are scheduled for an appointment, but now that we have access control officers, they make sure the inmates attend their clinic appointments. So we have no issue of the patient did not show up. They have to show up because it's their health. And this model also promotes the use of information technology. So the electronic unity health record comes into place. The scheduling system, which is new also, comes into place and is driven by information technology. This primary care model is it calls for continuous improvement. So the leaders in the institution are involved in the care of these patients. They have to promote a culture of teamwork, a culture of continuous learning and innovation by incorporating activities that evaluate and improve healthcare processes in the daily work of staff. Without the support of management, we cannot do it. So it's important that they become champions for the cause. The goal of the Diabetic Management Initiative is to ensure timely access to care, to strengthen the health care workforce, to implement quality assurance and continuous improvement programs. When we have all this in place, the focus on the patient will be to maintain their hemoglobin A1C level below 7%. We have to fix their fasting and prandial and post-fasting blood sugar levels. Step by step, we build up to this, And we have to make sure we maintain their blood pressure level below 140/90. And we start them on statin treatment based on cardiac risk status rather than on their LDL level. The patients are very important, and we must be focused on the goal. The goal is to reduce their sickness or avoidable deaths, really, and to decrease complications and help them manage their illness. And they have to be champions for their own selves. This calls for us to develop our teams. We have different teams that are focused on diabetic care, not only diabetic care, but inmates with chronic illnesses. So these care coordinator RNs and LVNs are trained on the nursing protocols, the diabetic care guidelines, and use of patient registry that has been established for this purpose, so they have a smooth flow and a smooth process when they go to work. In addition to training the LVNs and the RNs, the clinic, everybody that's involved in that clinic is trained on proper access to care, emergency response, and how to treat an individual patient on a one-on-one basis in terms of relationship and treatment. The diabetic patients also are going to be participating in classroom activities. That means we're going to be giving out patient care handouts that they understand, so they know to exercise, to eat the right food, to check their food, so they don't have and diabetic foot ulcers, and to make sure they are mindful that if once a diabetic, you have to have annual checkup for your eye, you have to have annual checkup for your feet, you have to have your EKG, blood tests over a certain period of time, because once they understand what is involved in their care, then they are more willing and able to participate in their own care. And what the nurses will do is they discuss their patient panel daily, Monday through Friday in clinic huddles, and then they attend the population management meetings that is headed by the chief physician and surgeon, where lapses in care are identified, where opportunities for improvement are identified, and where patients are further discussed, especially those high risk, high cost patients, and whereby we can provide them with appropriate care in the right housing or the right facility. So some of the resources that are going to be available to the nurses will be the nursing protocol, the diabetic care guides, patient registry, the patient unit health record, and medical records will make sure that these records are scanned in on time, so we have real time data to take care of this patient when we are taking care of them. The lab personnel is encouraged to draw their lab on a timely basis, and when they have a specialty appointment, the utilization management nurse, in addition to the telemedicine nurse and the specialty clinic nurse, make sure they get their appointments and their required follow-up appointments. So the goal is for the nurse to continually evaluate this patient, research their records, check the registry, make sure they are up to date on their medications, on their labs, on their visits. That way, their health is promoted and complications is reduced. The way we're going to evaluate this program